basically how we went about starting Las Charlas are local. It's a self-organized table talks led by expert speakers like yourselves, community leaders across Washington state. Las Charlas is an opportunity to share what you want, however you want. Las Charlas were created to inspire and connect expert speakers, leaders, and local businesses from different backgrounds to provide innovative businesses resources. You can expect to make a deep connection through your shared experience at our Charlas in a series of back-to-back presentations on everything related to business, technology, entrepreneurship to wellness. Speakers with diverse backgrounds and interests each have 30 minutes to present about anything they would like. And so I'd like to welcome, Carlos Olivares and Erika Ochoa from the Yakima Health District.
I also want to mention, just to add on that, the whole purpose of these charlas is especially we're wanting to give the resources and educational tools for our local small businesses where they can access through the charlas. So we invite multiple speakers and successors within our communities where they can kind of give our businesses some resources and information or pertinent information that could be happening or just keeping up to date with local information. That's what the charlas is about, is to keeping our community informed. So if you feel that you would be, you'd like to join to speak at our next charlas, feel free, reach out to us. You can reach out at info@cseyakima.com or give us a call 509-225-9921. So we can begin because I know we're on a time limit. I kind of like to introduce ourselves. We're Centro de Servicios Comunitarios in Yakima. So what we do is we help small businesses, startups. So we're given resources so then we can distribute it out into the community and to our local business owners. A part is my team. We're also all along on this call. And then what I like to do is like everybody introduce themselves just so we can kind of have an idea who's on the call. And we can begin with Carlos Olivares. Feel free to introduce yourself and let the community know who you are and a little bit about who you are.
Thank you very much. Thank you so much for inviting me to participate. My name is Carlos Olivares. I'm the Executive Director of the Yakima Valley Farm Workers Clinic. We operate clinics in Washington and in Oregon. And I'm delighted to be able to provide as much information as I possibly can about some of the most critical topics affecting our communities today. Mi nombre es Carlos Olivares, soy el director de la Clínica de Campesinos del Valle de Yakima. Nosotros damos servicios médicos y dentales a la comunidad en Washington y a las comunidades de Oregon. Quiero agradecer por invitarme a participar en estas conversaciones para discutir los tópicos más importantes que tiene nuestra comunidad hoy día y espero que sea una charla muy informativa. Gracias.
And thank you. We also have Dr. Marcus Pimmelton from the Yakima School District that I wanted to invite to be able to get to meet local community leaders like Carlos and Erika and the group itself. Thank you. If you want to introduce yourself as well, Dr. Marcus.
Yeah, I don't know what I came to. I just said, oh, I'll show up to whatever that is. So I'm here. My name is Marcus Pimpleton. I'm the Executive Director for Equity, Partnerships, and Student Engagement for the Yakima School District. My main priority right now is on teaching the system how to really engage and create this conversation about issues of race and equity so that we can see where the issues are that are keeping our system from effectively serving all kids. And we want to do that work in partnership with our families and with our community members and re-envision what partnership means, because a lot of times when schools say they want to partner with families and community, it is they want to sell you their agenda and they want you to understand it, but we want to kind of re-envision what it means to be in partnership and have some actual authentic power sharing. So I'm trying to connect with as many people and groups as I can, and we'll be building a coalition to kind of do this work together with us. But I've been in the system now here for just 6 months, so I'm still kind of figuring out where I'm at and which end is up.
Welcome and thank you.
Okay, so I know we're on a time frame, so now we can kind of get started with Carlos. He can kind of share a little bit, a few COVID updates, especially I think now that's a pertinent time, especially with everything that's going on. Cases are going up. Can you kind of give us a little information on that now, Carlos?
Yeah, I think let me start first by ensuring that people understand that in great partnership with the health district, we have been working from the get-go in terms of testing and ensuring that our communities have access, and there is plenty of access for them to be able to get tested to ensure the health not only of themselves but also of their families. Farm Workers Clinic, so far we have completed 25,000 tests and are continuing to do testing in our clinics. Whoever needs the test is certainly welcome. There are criteria, obviously. If you have a temperature, if you have a cough, if you don't feel well, we encourage you to come and see us. Also, and I'm sure the health district is going to talk a little bit more about this, but there are testing sites now available for our community. Why is that important? We have begun to see a significant surge of cases, for example, after Mother's Day. We begin to see surges whenever the community decides that they're a little bored with what this is, and as long as I'm just hanging out with my family, it'll be okay. The problem with that is, as you know, and I don't know if all of you do or not, but my family represents a reunion of 39 people when we all get together and have dinner. Unfortunately, I can't control who my children have gone and seen, who my grandchildren have gone and seen. And therefore, this virus is so devastating that we never understand who is carrying it, who is asymptomatic and still carrying the virus. So it is imperative that when you meet with your families, particularly those that you have not seen for a while, that you still create that social distancing as much as possible, that you wear the masks that are so critical for us to have. Unfortunately, our communities have been hit significantly higher than any other community in this valley. Hispanics have been hit the hardest in this pandemic. Many reasons for that, right? We talk about essential workers. Well, think a little bit about what essential workers mean. It means the people who are providing services in low-income paying jobs that without an option not to work. Well, that's our community, and they have to be there to do that job. And so they are way more exposed to this virus than many others who have the ability to hunker down in their homes and not worry about what the next paycheck is coming from. So it is imperative that we continue that thinking, that as long as you social distance, as long as you wear your masks, you're going to be protecting you, grandma, grandpa, all of the kids in the family, and everybody else that you come in contact for. So les pedimos con mucho cuidado de que el día de la Navidad, el día del año, del Thanksgiving, Halloween, all of these fiestas están viniendo, y lo que nosotros estamos pidiendo al público es de que por favor mantengan distancia, pónganse la máscara, no se reúnen en grupos muy grandes. Nosotros sabemos que las familias tienen la oportunidad y es parte de nuestra cultura de juntarnos muchos y ver, cenar juntos, pasarlos juntos. Entonces les pedimos que tengan mucho cuidado, ¿no? Haya mucha distancia y las máscaras. También quería informarle a la comunidad de que sí tenemos testing en todas las clínicas. Usted no tiene que ser un paciente de la clínica para hacer un test. Puede venir a la clínica y nosotros los vamos a atender. Asimismo, el Departamento de Salud que ya van a escuchar en un momentito más acerca de sus actividades, tiene suficiente testing en todas partes del Yakima Valley. So with that in hand, I also want to make sure and encourage people who need medication, who need to see a doctor. Please don't put this any longer. Come to see the clinics are open. Your medical provider, even if it's not farm workers clinic, should be seeing you today to take care of your conditions. Without your medication, without your regular care, you are endangering yourself and the rest of your families by not doing this. So we encourage you to come. There are visits that you can have via video, via your phone, over the telephone. We are happy to accommodate your needs in any possible way that we can to make sure that our communities already compromised because we have high incidence of diabetes, obesity, all of the elements that are very important when it comes to dealing with this virus. Our community, unfortunately, already has some of those in play, so we are even more vulnerable. So our message to you, to the small businesses, call us, call Bertalicia, and she'll arrange for our teams to help you test your workers at the most convenient times possible, making sure that you are well aware of what are the opportunities and the possibilities that you have as a small business. Berta Alicia and her team have been in this community for a very long time, and they are trustworthy. And in doing so, I encourage you to communicate with them, with us, with the school district, with the health department. We are here to help you. And if necessary, as we have done it before, we will go to the farm. We have gone to the warehouses to do the testing for our people, because we know that we are a very large silent majority. And that silent majority has to wake up and start doing the right things for ourselves so that we are not victims, that we are proactive on the things that we need to do. In my last pitch to the community, if I may, is among all of the important things that you have to do in your lifetime, today is the most critical piece that you can do is go out and vote. Do not be intimidated. Do not let people take your right to vote. That is the most precious thing that you have in this country. Exercise it. Do it with conviction, and do it as soon as you possibly can.
Carlos, I have a question for you. You know, I get this asked a lot. As we move into the winter, is there a possibility that there could be another lockdown? And if that is the case, what advice would you give the local businesses to prepare for this now? And what have we, now that we've already gone through this?
Yeah. The most important thing that you have to think about when there is a crisis is not how are you going to cope with the disaster that's coming, but how can you cope with preventing the disaster to happen, right? Because once the disaster has happened, we're running around like crazy people trying to figure out what we're going to do. Instead, what we should do is try to prevent it. Everything that I've been talking about today has been to do that, exactly that, to prevent it. However, it is also important to recognize that those people that are hurt the most when the economy shuts down are our people, because they are living from paycheck to paycheck. Many of our folks are undocumented. So when people say, well, they'll collect unemployment, really? No, they're paying taxes, but they never get the opportunity to collect unemployment. So I resent the notion that everybody's going to be okay, because we know that it is not true. Correct. So in order to protect those people, protect their income and their families, the best thing that we all can do is wear a stinking mask. It's not that hard. And social distance yourself so that you can protect you and you can protect me. So I encourage you to be a good citizen. do the things that will stop the economy from shutting down. And again, por favor, voten, vayan a votar, porque ese es el ejercicio más importante que todos ustedes tienen, es de votar. Entonces les ruego, por favor, que voten. Hope I answered your question, Alicia.
Yes, yes. Thank you, Carlos.
I have a question.
Sure.
So when you go and get your COVID testing, is it free?
Yes.
Okay, great.
Absolutely.
I think that's
Between-
good for everybody to know. When you guys go get tested, it is free at no cost to you. Also, another question, is it required to present identification when you go get COVID testing?
No.
Okay,
No,
Okay.
I think what we need is information about who you are, where you live, what is your phone number. And the reason we want that information is
Okay.
because if you test positive, the health department has to have the information to be able to check on you, to see if you're being isolated, to make sure that your family is in good shape, to tell people that you have come in contact, that there may be a slight possibility that you may be infected as well, and that we need to keep you safe, move you away from crowded situations that you live in or that you work in, so that you protect all of the people around you. So it is imperative that you trust the people who are asking for those things, because I promise you, we will not use that for any other purpose.
good. Okay.
Period. Nobody gets that information. I don't care if it's the immigration people. I don't care if it's the police. I don't care if it's my grandfather coming in and demanding that from me. They will never get that information unless it's a court order. Then we do not have a choice. But other than that, I promise you, that information is kept confidential for the families.
That's really, really good information. And I think we have somebody that's online, and if you could just basically repeat that in Spanish, it'd be good for him to, he's from out of town. So.
Muy bien. Lo que me están preguntando es de que necesitamos un tipo de identificación para hacer el test del COVID. Y la respuesta es no, no tienen ninguna necesidad de darnos información privada. Necesitamos su nombre, necesitamos dónde vive, necesitamos su teléfono, porque si es que usted tiene un test positivo, entonces es importante de que nosotros sabemos dónde está, para que el Departamento de Salud de Yakima los pueda llamar y comunicarse con ustedes e informarles acerca de la condición que usted tiene, ya sea negativa o positiva. Si es positiva, van a tener ellos que trabajar con ustedes, asegurarse de que ustedes no están contagiando a otras personas en la comunidad o en su familia. Pero es muy importante que ustedes también entiendan que esa información es estrictamente confidencial. Nosotros jamás podíamos dar esa información a la inmigración, a la policía, al condado, a nadie. Estamos reservando esa información en nuestra oficina sagrada sin sacarlo a ninguna parte por ninguna razón.
Thank you, Carlos.
You're welcome.
Great. I think that was really important information to kind of get out to the people, to let them know, like, hey, no identification is requested, and it is also free. I think those are the two most important things and questions that we get. And I feel that the community needs to know, because there's always questioning about, well, who's going to be there, what kind of information they're going to take. So that was something important that I'd like them to know. Well, thank you for your time. If there's anything else that you feel that you'd like to cover, feel free to share it with us. But thank you for coming on and just kind of giving us some new updates and some information, especially during this really important time, especially businesses in our local community and the globe dealing with this pandemic. I really feel like it's important to kind of keep our local community updated with the new information or things that come out. And especially thankfully for technology, they can kind of access this information a lot quicker and faster. That's the whole purpose of these charlas as well, is to kind of get out that information so that people can see updates. Thank you again. And I wish you the best, and hopefully we'll see you soon, and hopefully we'll have you on in a future charlas again. And if you guys have any questions for him, feel free to reach out to us. We can kind of extend something out. Maybe we can get the answer for you some way or another. You can email us at info@cscyakima.com. Or if you're not familiar with email, just give us a call, 509-225-9921. Thank you again, and we'll see you soon.
Thank you so much for inviting me again one more time. And I know I'm going to miss the discussion with the health district. I just wanted to just do a public thank you to the health district. They have been amazing partners. They have paid attention to the questions that we have asked them. They have really focused on our Hispanic community. And I think that not often do they get the recognition and the accolades that they deserve, the hard work that they've been doing. So I'm sorry I'm going to miss your part. I have a board meeting I have to run. So thank you again for taking giving me the opportunity.
Thank you. Thank you.
Bye-bye.
Bye.
Hi, Erika. Thank you, Erika, for coming as well. You know, you're always so good about the outreach and giving the community the education that's needed. So it's on. Feel free to share what you feel is important for the community.
Wonderful. Well, thank you, everyone. Again, my name is Erika Ochoa, and I work for the Yakima Health District. I'm a community health specialist there. And during our COVID response, I'm working with a public information officer, very much focused predominantly within our Hispanic community, and making sure that any information we share is culturally relevant. And so that's what I've been specializing in, doing a lot of different communications and marketing as to how to make the information we're sharing, public health recommendations, as accessible and understandable as possible. So I did want to start by sharing where you can find what phase we're in and what our current activities are. So I will do a screen share so that you can follow along with me. It's just, and I'll double check that that's something I can do on my end. And I might need that enabled.
Yeah, give me one moment.
And so, like most of you know, we have moved to phase 2 in Yakima County. And so we get a lot of questions, what does that mean? And a lot of them might be, oh, this means that the cases are going down and it's safer. And so it can be really misleading. And so I wanted to make sure to let you guys know that just because activities are opening or extending their capacity does not mean that the threat is gone. It does not mean that we can stop wearing our masks. It does not mean that we can have larger gatherings. Just because the restaurant is open or the bar is open till 11 now doesn't mean we should be there for 5 hours. We should still follow the public health recommendations, limit who we interact with outside of our own household, and the duration of that. So I'll still show where you can find our information. And this is at the Yakima Health District page. And I'll start from the very landing page. So if you, whether it's the city, the county website, or the specifically Yakima Health District, by clicking this read on at the top of the banner, doesn't matter how you get there, it'll take you to our COVID-19 landing page. So the Safe Start Yakima County is where you're going to find this information. You're going to click on that off to the side, and it'll tell you Yakima County is in phase 2. And so you can read what the approach is there. And we also have a summary to kind of show what it means for gatherings, what are some new extensions, for example, fitness and recreation, and what it means for the businesses. We have this available in Spanish. Aquí tenemos esta información acerca de cuáles son las actividades y negocios que pueden abrir o expandar durante la fase número 2. Y esto es algo breve. This is just a high level overview. To find more information, more detailed information, I should say, you're going to go up here. And especially for businesses, there is more, we get a lot of different questions about what this means. And so to find what that may mean, or what that means to your business is where you can find more information. So this again breaks down all of the different phases. And keeping in mind, we were in a modified phase 1, so maybe a lot of the phase 2 we were already doing in a modified phase. Muchas de las actividades que a lo mejor estamos viendo en la fase número 2, en nuestro condado tenía el permiso de hacerlos en una fase modificada 1. Entonces, como se siente que a lo mejor muchas cosas no abrieron, pudieron haber sido expandadas. New things right off the bat, for example, it's like movie theaters. Libraries were not open before. It was only curbside pickup. Now they're open at a decreased capacity. You can see movie theaters are at 25% capacity. Libraries and museums are at 25% capacity. If you're in a bowling league, you can go practice again with your bowling. Not open to the public, but it's part of the league. More expansions for real estate. Like I mentioned, restaurants, there was an increase for restaurants as well, or personal services like hair and nail salons, barbershops. Entonces aquí uno puede ver las expansiones que a lo mejor pueden ser de la capacidad que uno puede permitir adentro. Por ejemplo, las estéticas, los salones de belleza, esos tipos de negocios subieron la capacidad. Y también, por ejemplo, los restaurantes que a lo mejor si fueron pueden nada más abrir hasta las 10, ahora pueden abrir hasta las 11. So that's some information. And I can share more on our landing page here. As far as questions from employers, what this can mean, we still encourage you to make your business as safe as possible for the people that you want to invite in. So public health recommendations still stand. You still need to require, it's a state mandate to have your masks, have all individuals entering your business wear a mask properly. So the mask should cover the mouth and the nose. We've seen a lot of people, we've all seen the people who wear their masks underneath their nose or down by their chin. The minute they come in, they maybe wear them correctly, but then pull them down below their face. And so that's posing a health for other individuals. So it's, as business owners, it's very important for you guys to really follow these mandates and enforce them. And so I know I was at a local restaurant, locally owned restaurant, and an individual wanted to get up and go to the restroom without a mask on. And it was really nice to see that the hostess there, or the manager there, whoever she was very direct and said, "Sir, you need to wear your mask if you're going to get up off the table to go to the restroom." And so it's okay to do that. That is what you want to see. For me, knowing that business was following that rule, I would definitely go back there again, and I feel secure to recommend it to other people. Go there because they're going to follow those guidelines. Entonces, lo que estaba mencionando, como ser un propietario de un negocio, es muy importante que sigan las recomendaciones de salud pública en su negocio. Por ejemplo, yo fui a un restaurante local y una persona se levantó para ir al baño sin su cubreboca, y una de las personas que trabaja ahí le dejó saber que se tiene que poner su cubrebocas si es que no va a estar manteniéndose sentado en la mesa. Y eso para una persona como yo me gustó ver eso porque es que están tomando estas reglas en serio. Y entonces así me da a mí más ganas de continuar a ir ahí o comprar su comida y también dejarles saber a las otras personas que pueden ir ahí porque ellos sí están siguiendo las reglas. So I'll share that. And I also have Mary on the line from our environmental health department. She's on the line if there's any specific questions here from businesses. Since I work a little bit more in general public health recommendations, and I also wanted to touch on with a little bit more detail on some of the recommendations for celebrations and gatherings. But I wanted to give that opportunity if there's any businesses on that have questions or specific questions that Mary or myself can answer. Si alguien tiene unas preguntas en específico acerca de su negocio y la fase 2 modificada, ¿qué es lo que significa? Aquí tenemos una persona también en la línea conmigo que les puede ayudar a contestar esas preguntas.
I have a question. So I'm wondering what the protocol would be if a small business had someone contract COVID that was one of their employees, or they were knowingly in contact with someone who did have COVID.
Do you want me to take that one, Erica?
Yes, please.
Okay, yeah. So businesses should have their COVID-19 safety plan in place to be operating right now. So they should be prepared. This is part of that plan is, what do you do if one of the employees tests positive and has close contact with other employees? So we recommend the CDC guidelines of for positive cases that they are isolated for the 10-day period. I'm trying to think. There should be a policy in place with the screening of employees. Employees should be reporting that as soon as possible to their employers so that they know not to go in. And then the employer should be asking, did you have the close contact with any of the other workers? And it's recommended that those workers then follow the quarantine guidelines, which is the 14-day period. So that there should be a plan in place ahead of time for employees to know who do we contact, which manager, which person, what sort of the protocol. And really the most important thing is that there's as quick as possible, isolation and quarantine, isolation for the positive case, the quarantine for the close contacts. And then there should also be a deep clean and sanitizing of any of the work areas that worker was in. So we're recommending just sort of all of the CDC guidelines for that scenario. We have a lot of resources we can provide for that, but that should be something that is planned ahead of time so that everyone's prepared and can act very quickly.
And I also, that's pretty good, Mary. I also, having a COVID safety plan in place, I really feel that a lot of people don't know enough about the LNI one-on-one consultations. And in those consultations, you can get free advice and information without being penalized. They're just there to help you understand, making sure you're complying with hazardous and safety measures, especially during this pandemic phase. And they also have a COVID-19 safety plan. So I feel like you guys should take advantage of those resources that are offered. Or if you guys just need some direction, feel free to give us a call and we can make that connection for you guys. But I really think that's a really good resource that people need to know, or especially our local businesses, that scheduling these one-on-one consultations with LNI so they can just to make sure that you're complying with the safety regulations. And especially this is new to everybody. A lot of local businesses or businesses in general don't know what to do during this time, so I really think that would be a great time to kind of come out, making sure you're complying with the safety hazards today with COVID and everything going on. And then you can put your COVID-19 safety plan in place. But you guys can feel free to reach out to us. We can kind of guide you in the right direction, give you the tools and resources that you need in order to get a COVID-19 safety plan. If you just feel free down in the comments, put your contact information, give us a call, 509-225-9921, or email us at info@cscyakima.com, and then we can kind of help you and guide you and direct you where you need to go. That was a great question. Does anybody else have a question?
I have a question on, I think you touched on it a little bit, but just general disinfecting techniques for local businesses. And this is just like as a preemptive measure, not necessarily when someone has contracted COVID-19, but to kind of keep it in their daily repertoire. What does the CDC or the health district recommend?
Yeah, that's a great question. So the EPA has a list out called List N, just like the letter N. And if you just Google that EPA List N, it pulls up all of the registered disinfectant products that are active disinfectants against COVID-19. So if you're just sort of looking and wondering what kind of product to use, you can look there. It has all of like their brand names, what type of surfaces they should be used for, if they're food contact surfaces, non-food contact. It gets really specific and is a really great resource. I can put that in the chat as well. But also a chlorine bleach solution, it can be as simple as that and as effective. So we recommend certainly doing just continuous routine cleaning of like high touch surfaces. So, door handles, countertops, anywhere that just gets a lot of frequent contact. And then for places that, have a lot of traffic or have the capabilities, doing sort of a deep clean, maybe every night or once a week. It's just the more you clean, the more effective it's going to be, right? So there's the cleaning aspect, which is like a soap and water, you're cleaning off dirt, bacteria, but then also making sure you're following that up with a disinfectant. And that is what's going to really kill the COVID-19 virus, and making sure you're following all of the directions of the product you're using to making sure that it's most effective. So it's just going to be sort of implementing what is going to work for that business. What do they have the capacity to do? Maybe just assigning it to a specific person throughout the day or each shift, but really focusing on what areas are getting the most contact and what solutions, what products should be used in those certain areas.
Great, that was a great question.
Real quick, I have another. What are your thoughts on some regular activities going back to normal? Do you think it will be sooner or later?
For like increasing more activities into phase 2?
Just where we're at with the COVID. I mean, is this something that's going to be, are we expecting long, a year or two? What are they saying about that?
Honestly, I think about it this way, based on like the different calls I've been on with the Department of Health. We haven't even made a full circle, right? A full year yet. And so we're going into uncharted territory right now with fall and winter. Because in our state, it started, I believe the first case was end of February, and then it started in Yakima in March. Mary, correct me if I'm wrong with those dates, but we haven't seen its full impact, right? And so one of the biggest things we're encouraging right now, also with a lot of support from agencies of federally qualified health centers like Yakima Valley Farm Workers Clinic, is, for example, the flu shot. And so maybe individuals, we're hearing a lot of people who have maybe never had it before, for whatever reason, are opting for it this time. And how the public health measures we have for COVID can hopefully help prevent maybe seeing spikes in flu and maybe RSV, other winter type sickness, because we're going to hopefully still follow public health recommendations. We're not going to be within close contact as we have been before, everyone should be wearing their mask. It's a required thing. Disinfecting is, through the roof right now. So hopefully that following these public health recommendations and protecting yourself from the flu can maybe make these next 3 months better than maybe they've been before. Instead of worse, instead of, oh, we're still going to have flu and COVID. Why not, like what Carlos said, let's prevent. Let's see how this can prevent and keep some of those flu numbers down, so that we're not panicking. We're not, I'm pretty sure I'm not the only one that wakes up and feels a tickle in the throat and be like, oh my God, why does my throat hurt? Right? And think and say, okay, is it because it's a weather change? Is it a cold? And so, and I can share some information with that, but really, really pushing for being healthier. As the healthier we can be, the better outcome we can get. And remembering how this virus is contracted. This is a people-to-people virus, right? So really, really keeping that in mind and being mindful of, we may not get all the way back to normal, and it may take some time. And we're human, we need human interaction, but kind of like choosing and being a lot more vigilant about who we interact with. We all have social media. We can see, who's going to parties. We can see who's following what. And if that person reaches out to you and says, hey, do you want to come over? I'm having Friendsgiving this year. Make that right, decision. And it's okay to turn an invitation down. It's okay to say, you know what, I'm going to be cautious this year. Be safe. Don't invite too many people over. Just because we want so desperately to get back to normal that we don't want that to like bite us in the butt and then have a spike all over again, like you mentioned earlier. And, the best thing we can do is prevent and then see what happens as the state tries to work out a vaccine and see how that goes.
So, given that the holidays are coming up, right? And so we obviously expect people like, hey, stay home, stay home, stay home. But there are going to be those chances where people are just going to continue to go anyways, right? I feel like it's important to talk about for the people that want to go anyways and do what they want to do anyways. What are the things that they can kind of do because they're going to make that decision to go? How can we prevent? What are some preventable measures that, because the people that want to go, what can they do on their part to kind of reduce the risk?
Definitely. And I have a perfect website to share with you guys.
Oh, good. Okay.
Yep. That way we can follow along and really take this to heart.
Yeah.
And here is the Washington State Coronavirus Response page. This has just also been recently translated, which makes me very happy. It was hard to share this and then not have it be available in Spanish.
And one thing, Erika, sorry, can we also translate this information into Spanish? That way we can kind of give both of our audiences the opportunity to understand what's being discussed. Okay, thank you.
We'll start off with the English. So here's for safer gatherings. So right off the bat, fewer, shorter, smaller, safer. How to celebrate during COVID-19. So we've got some recommendations here, like you mentioned. So like we said, if you decide to gather, there's always a risk of spreading COVID-19 infection. So let's help lessen that risk through pre-planning conversations and maybe doing some trade-offs. It's not going to be exactly how it was before, but here are some recommendations that if you are going to gather in person, that it can help you plan accordingly. So before you gather, here's a list of recommendations. Right off the bat is just be very clear, have that conversation with your guests that you're going to make safety a priority and get some ground rules right off the bat, whether it's bring your mask, bring your hand sanitizer, and obviously, if you're not feeling well, stay home. Reviewing your guest list. Are you inviting anybody that's from the high risk category? Keeping in mind holidays, like you said, individuals who are older, whether they're your parents or your grandparents, maybe you have someone that has a chronic condition. We want to spend time with them, but if we're going to be putting them at risk because we know we're going to have someone, one of our relatives that we know hasn't been wearing a mask, that's not following the public health recommendation, it's going to be awkward. But who are you going to invite to your home? Someone who's been following the recommendations or someone who hasn't? And do you want to put your family at risk? Do you want to put that person, your grandma, at risk by spending time with her? Maybe do something one-on-one with her 2 weeks before, so that we're not putting that individual at risk. Could be an idea. Again, your guest size should follow what your county phase has. And ours is 5 people outside of your household. That does not sound like a traditional Thanksgiving. That does not sound like someone's regular get together. So we have to do some trade-offs. So maybe start celebrating a little earlier so that every 2 weeks, every 14 days, we can be either video chatting. If there's people from out of town, they don't have to come into town. You can set up some Zooms. You can do some FaceTime. If you have people that are closer to home, maybe just limiting that to those 5 people or fewer that are closest to you, and then keeping in mind health checks, right? There was a really good suggestion here that says, ask guests to, if you know, for example, you're gonna go visit someone. So it's called consider a pre-event quarantine. Including yourself, try self-quarantining for 14 days before the gathering, especially if you know that, maybe you work a high-risk job, maybe you're an essential worker, maybe you work at you know what I mean, and you don't want to put your relatives at risk. Say, okay, I'm going to take 14 days. If I'm going to go to work, I'm going to come home and I'm going to be extra safe. I'm going to not gather with other people. I'm going to wear my mask. And by the time it's time to gather 14 days later, you're not having any symptoms, you're not running a fever, you're good to go. Still also continue to monitor yourself after the event. That's another one here for after you gather is keep in mind, some people may not be truthful. Some people may say, hey, yeah, I haven't been feeling sick. I've been fine. And you gathered with your family and then you start feeling a little sick. We're encouraging you to get tested. We're encouraging you to get tested. If that test has come back positive, then reach out to your family and say, hey, 2 weeks ago we had Thanksgiving. Well, I got tested. I wasn't feeling too well and I'm positive. Let them know. Let them know so that they can get tested. That's very important. Para las personas que a lo mejor estamos planeando tener unas reuniones, les quiero compartir una página en español donde pueden ver unas recomendaciones en cómo nos podemos reunir con más seguridad. Si es que una reunión es lo que de veras queremos hacer, una reunión en persona, recuerden que nosotros les queremos recomendar que busquen una diferente alternativa. Entonces, la página donde pueden encontrar esta información es el coronavirus.wa.gov. Al entrar, pueden cambiar esto en español. Y básicamente las recomendaciones que les estamos dando es, esperemos que se puedan reunir de otra manera, pero si es que lo van a hacer en persona, que tomen en cuenta que nada más puede ser, se recomienda en nuestro condado con no más de 5 personas fuera de su hogar para reunirse y que tengan sus reuniones breves, que sean con pocas personas y que también que sigan unas recomendaciones acerca de cómo van a planear antes de este evento. Entonces aquí hay una lista de seguridad para las reuniones. Se ve muy larga, pero básicamente es tener esa conversación con los invitados, dejarles saber que van a tener ciertas reglas, como tienen que usar su mascarilla, a lo mejor no invitar o hacer que sea la reunión breve para personas que van a invitar que a lo mejor están en una categoría de alto riesgo, como personas de la tercera edad, mujeres embarazadas, personas con salud crónica, que están más al riesgo de enfermarse del COVID-19. Y luego también preguntarles si se han sentido mal en las últimas 2 semanas. Y obvio, si uno no se siente bien, no ir a la reunión. Entonces aquí también pueden ver, esto es para planear antes de la reunión, luego las recomendaciones durante, es ponerse la máscara, abrir las ventanas para que tengan una circulación de aire libre y luego también no compartir vasos, cucharas ni otras cosas al comer y guardar una distancia que puede ser muy difícil. Y luego, obvio, para después de la reunión, por cualquier cosa, si durante de los 14 días después de esa reunión uno tiene un síntoma, que vayan a un sitio de obtener su prueba de COVID gratuito o a una clínica o con su médico. Si es que salen positivos, que por favor les dejen saber a las personas con quienes estaban en contacto en esa reunión y después para dejarles saber que a lo mejor pueden haber sido expuestos.
Great. I think that's some really good information that you shared. And I do have a question, Erika. Oops, give me 1 second. Oh, okay. Now, so I saw some really great things on how to take preventative measures and things and that forth. But is there anything that we can also distribute that is more on a internal health, like as in taking vitamins, taking more input of fruits and vegetables and things of that nature? Is there like any information that we can kind of also bring awareness to this also situation that's arising?
Yeah, we don't have anything specifically that we've been pushing out at this time. But obviously, even early on, especially while we were in a quarantine, really pushing the importance of, if you're going to be staying home, especially right now, winter and fall, I feel like winter just snuck up on us, and it's not even, fall just didn't even happen. We had like a week of fall. Yeah. And so taking advantage of maybe if you can still get some exercise in, whether it's even if it's shorter walks outside, definitely exercise is going to be really important, or finding YouTube videos or different things that you can stream and do indoors to keep that physical health going. Like you mentioned, eating healthy, eating the right foods. I know sometimes we put that in the back of our minds during the holidays because we want to indulge. Like we have 2 holidays. It's not every single day, guys. So 2-3 days, maybe you can indulge. It's not every single day.
I agree.
But the healthier we can be, which is why we, the Yakima Health District, along with all of our clinics and hospitals, are really urging you, Department of Health, the CDC, everyone really wants everyone to be as healthy as possible, especially in these winter months, because we would hate for someone to be like, is this a cold? Is this the flu? Is this corona? And then also we're leading into like mental health. We're going into winter, and we want everyone to be as healthy all the way around. And so checking up on people is important, especially if we're going to keep isolated. So if we can't get together physically, we can try to stay together on that site. You could also see virtual ways to stay connected, sending a message saying, I'm thinking about you, or sending a funny meme, or FaceTiming. whatever we can do, dropping off a coffee for someone that you haven't seen in a while, especially if you know that maybe that person does suffer from seasonal depression on top of what's already going on. Staying in touch sometimes doesn't have to be a face-to-face. So telling someone you're thinking about them, and then also knowing what resources are. I know we're almost out of time, and so that's one of the things I wanted to share is reaching out to an agency like yours for the businesses is great for resources, but then if we do come down to a positive case and you don't know what you're going to do as far as income or other resources are concerned, I know that Carlos didn't touch on it, but the Yakima Valley Farm Workers Clinic does have a care coordination that is provided by the Department of Health that can connect you. If you are positive, it can connect you to resources that can help you and your family, whether that's financial, that's mental health, that's other resources.
Please share that in Spanish as well.
Yeah.
Yes, that's really important.
And then the Yakima Health District also has a community health worker program that can connect you. Para las personas que a lo mejor salgan positivas o están esperando sus resultados para su prueba de COVID-19, queremos asegurarles que agencias como la Clínica de Campesinos y nosotros en el Distrito de Salud tenemos diferentes recursos para ayudarles y apoyarles a ustedes para que no haya una excusa en por qué no ir a recibir esta prueba. A veces decimos, pues si es que vamos a hacer esta prueba, no puedo trabajar porque me tengo que esperar para mis resultados y si salgo positivo no puedo trabajar y quién me va a pagar mis biles. Entonces, la Clínica de Campesinos está recibiendo información de parte del Departamento de Salud que les puede comunicar con una manejadora de casos, por ejemplo, para dejarles saber cuáles recursos les pueden ayudar a su familia financieramente o también con asistencia de salud mental o cualquier otra cosa. Y por parte del Distrito de Salud tenemos un programa de promotoras que son 20 promotoras que nada más hablan español. Este programa de promotoras es específicamente para nuestra población hispana y ellas le pueden ayudar con cualquier recurso, o sea, ocupan alimento, ocupan cubrebocas, ocupan un recurso en cómo pagar ciertos biles y para ese recurso no ocupan ser pacientes de la clínica. Para las promotoras de salud, nada más pueden ir a la página que voy a poner en el chat y ahí van a ver un número de teléfono y pueden llamar también. Y es covid19esreal.com y les puedo enseñar la página para que así puedan ver de estos recursos y se puedan comunicar con una promotora por teléfono. Todo este sitio es en español, aquí está el número de teléfono, o pueden mandar un correo electrónico. Aquí pueden ver quiénes son las promotoras, un poquito de ellas. Estas promotoras fueron entrenadas aquí en el Distrito de Salud y fueron aprobadas por el Departamento de Salud y ellas les pueden mandar textos, llamadas telefónicas, les pueden llevar recursos por fuera de su casa, pero no pueden hacer visitas persona a persona. Pero tenemos este recurso disponible para ustedes y ellas les pueden ayudar a conectarse con otros recursos que a lo mejor las personas con limitad de lenguaje de inglés o acceso al internet no lo pueden hacer. Ellas les pueden ayudar.
Great. That is such great information. Thank you for sharing that.
Thank you, Erika.
And I do want to kind of share bear with me 1 second. I want to share, I think especially not only is all these great things preventative measures, but your health, your internal health, taking your vitamins, your supplements, eating correctly, eating more fruits and vegetables, doing exercise, but also not only, I think the mental part is an important thing, especially so crucial right now. So if you guys feel at any time you guys need somebody to talk to, I want to give you this phone number. It's a 24/7 emergency hotline. It's 1-833-681-0211. They are open 24/7. That's an emergency hotline you guys can call. If you just need somebody to talk to, feel free, reach out. If you guys have any other questions or just need any more resources, feel free to reach out to us. I want to thank you for taking the time for speaking with us today. I believe it was
Yes,
really,
thank you, Mary Cohen and Erika.
yes, it
Thank
was
you
really
so
good
much.
information. And I feel if anybody, if you guys have questions, concerns, feel free, reach out to us. Leave a comment below or just email us or give us a call. And then I believe the next charlas that we have is on November 18th. Keep a lookout for like the event details and things of that nature. And if you feel that you have pertinent information or you want to share some business resources or just some local updates within the community, feel free to reach out to us. That's what it's about. It's that platform to give people to share great information and resources and educational tools. That's what this is about, is helping each other out, finding new, networking with different people, finding out information. Again, thank you so much, you guys, Mary and Erika, for coming on in and just sharing some great information. And we will see you guys soon. The next charlas, November 18th. And if you guys have any questions, or if you're trying to reach out to Erika or Mary, feel free to shoot us a message. We can send over their contact info. Or if Erika, you guys can go ahead and put your contact info in the chat box. Thank you again, you guys. Thank you for joining us, and we will see you guys soon, okay?
Thank you, guys.
Thank you. Have a good day.
You too.
Bye.